Good morning and welcome to TableTalk, Talks, Togetherness, and Transparency. Today, we're happy to have with us a special guest from one of our valued community and business partners, MUSC Marion. Today, we have with us Dr. Anyim, who is a medical director for Hospitalist Services at MUSC Marion. Welcome, Dr. Anyim.
Thank you so very much, Dr. Bethea. It's my pleasure to be here.
Well, we know that you have a tremendous schedule, and we thank you for just shaving off a small portion of your time today just to share some helpful information with our community stakeholders, our parents, and our families. So thank you so much. As we continue to deal with the many aspects of this virus, there are just so many questions and so many concerns and so much uncertainty. We thought that having one of our medical professionals to provide some updates and information would be helpful, specifically for our families and our staff members and community members. So Dr. Anyim, first of all, can you just give us an overview or how are things going in terms of with MUSC and the virus? Are the numbers starting to look any better or how are things right now?
Well, at the moment, our census has been the lowest in the last several weeks. I know for sure MUSC Health as a network and MUSC Marion by extension is more than capable and has been well prepared to attack this pandemic as it relates to our local community as well. But today our census has gone down. I'd like to just briefly add some numbers as of February 2nd, 2021. And I know we serve a catchment area. In Florence County to date, there's been over 15,000 cases. Unfortunately, there has been 357 deaths. More particular to us is Marion County. As of February yesterday, there has been over 2,897 cases, and unfortunately, we've had 87 deaths. And Dillon, our neighboring county, has had 3,543 cases to date with 70 deaths. However, today our census has been the lowest. Of course, we do share our medical care of patients with MUSC Florence, which is our major referral center, and of course, MUSC Charleston. So we have many of our patients who have come from the Marion County area who have been transferred to Florence also. But specifically to your answer, to answer your question, rather, our numbers are going down, and we hope it continues to trend down because that speaks to the overall health of our population and decline in COVID cases locally.
Absolutely. Well, we again cannot commend just medical professionals at MUSC and across this country for the tremendous job that you all are doing. We hear about the different variants of the virus, and recently DHEC released that a new variant was here in South Carolina. And so with so much uncertainty, one of the things that we have now is the vaccine. And so can you talk a little bit about the vaccine? I do know that people have a lot of mixed feelings about the vaccine. I've heard a lot of misconceptions about the vaccine as well. So can you just give us an overview or just some helpful information concerning the COVID vaccine?
Absolutely. At present, the FDA has granted emergency use authorization to two companies, Pfizer and Moderna. More recently, Johnson & Johnson has also come to the fore saying they have a vaccine that's ready to go to the FDA for approval. I'll quickly add that MUSC at the moment is offering the Pfizer vaccine. Now, what the Pfizer vaccine and Moderna vaccines have in common is the way they work. The mRNA, the method of delivery of the vaccine, and this requires that these are stored up to 90-something degrees below zero, which MUSC has been prepared for and is currently offering. Moderna vaccine has not yet been started in our local area in terms of administration. And as I mentioned, Johnson & Johnson is yet to obtain approval for emergency use authorization as well. I will hasten to add that I've taken the vaccine, and so has many of our healthcare team members here in Marion and throughout the MUSC network. I'm also aware that other healthcare entities in the surrounding areas have been offering the vaccines to healthcare workers. And now, of course, we're doing mass immunization or vaccination of community members. And so we are making every effort to have this vaccine available to the community, particularly starting with our very elderly, vulnerable population, and of course our frontline workers, essential workers. Those are the current people who are receiving the vaccine. So we're commonly using now the Pfizer vaccine, Moderna vaccine is out, DHEC and MUSC, we've not started to offer that. And just to summarize, the Johnson & Johnson vaccine is not yet available. However, we do encourage everyone, once it becomes available to you, to get the vaccine.
And I know that MUSC has had different events where they've done some mass vaccinations. And I think there is an upcoming one in Marion County as well. But again, as you stated, you're still operating in that phase 1A, which, you know, is a very select group of individuals. I do know as educators, teachers are in group 1B. And so we're looking forward to transitioning to 1B, but understanding the need to make sure that you're covering all of those 70-year-olds as well as our healthcare professionals. Anything else in terms of anything that we can be doing just as citizens, community members, regarding the virus? Any recommendations that you have? We as a school district, we are constantly pushing those protocols, but any, just from your words.
Absolutely. Number one, prevention. I'm from the Caribbean, I must add, and we always say prevention is better than cure. Number one, we highly recommend that every member of the population, certainly over age 2, would wear a mask. We encourage social distancing, and it is said more than 6 feet apart when you're talking to others or interacting with them. And of course, frequent hand washing as well. And if the vaccine is available to you, regardless of the phase at all, whether you're an essential worker, and of course, being in the classroom, you're exposed to younger children who may not show any symptoms of the virus or viral illness or infection, you have to make sure you do your social distancing, wash your hands, wearing a mask. And I'll add paying attention to your nutrition is also very important, and stress management. Anything that weakens the immune system, whether it's a disease condition, including diabetes, cancer, if you're on certain medications for rheumatoid arthritis, for example, anything that causes your immune system not to be ready to fight for this virus that is now trying to wreak havoc in your body, you need to do. So we advise adequate rest, nutrition, including plenty of fruits and vegetables, exercise. All of those things help us to boost our immune system. For those who do not like to eat vegetables and fruits, at least take a multivitamin. An adult multivitamin is very important. And of course, for children and teenagers who are in their school district, we advise lots of good nutrition and vitamins that are appropriate for their age group as well. I'll hasten to add what we have seen locally on some occasions is that there are people who go to funerals or a barbecue or singing in the church choir. Those people are the ones, when you do some contact tracing, unfortunately, these are some of the places that the virus has been spread more. You know, unfortunately, we have our friends and we long to see them, our grandparents and so forth. And those things, unfortunately, those events can put us at risk. So please be mindful if it's not someone that you live with or is in your inner circle, so to speak. Regardless of the event, please stay away, make alternative things, whether meet on Zoom or group chat, text, what other media outlets you have available, utilize those, but maintain your distance as much as is possible until we get a grapple on this condition. Nutrition. Please remember, chips and all of that does not give nutrition. Please, fruits and vegetables as much as you can eat daily, exercise, and adequate rest. And taking your medications, I must add. If you're diabetic and your sugar is out of control, you, of course, have worsening of your immune response to this virus.
Absolutely. Dr. Anyim, the information you have shared has been wonderful. And I hope that our families, our community, they use the information that you have provided. I thank you again for just taking time off your schedule. You've done such a wonderful job. I'm sure we're going to want to have you back at some point as well, Dr. Anyim. But again, thank you and your whole team out at MUSC for a job well done. Stay safe. Everyone, we want to thank you again for watching Table Talk. Please share this information. Please share this information. Please follow the protocols. And again, please listen to the information about the vaccines as well. Thank you so much.
Thank you, Dr. Bethea. It's our pleasure. We at MUSC Marion and the entire health network, we seek to give our best to every patient that comes to our door. And it's my pleasure to be with you today.
So much.